Esophageal achalasia is a rare condition that affects the muscles and nerves of the esophagus, the tube that connects the mouth to the stomach. It causes the lower esophageal sphincter, a ring of muscle at the end of the esophagus, to fail to relax and open properly. This prevents food and liquids from passing into the stomach, leading to symptoms such as difficulty swallowing, regurgitation, chest pain, heartburn, and weight loss. Esophageal achalasia is estimated to affect about 1 in 100,000 people in the United States, and it can occur at any age, but it is more common in middle-aged and older adults. The exact cause of esophageal achalasia is unknown, but it is thought to be related to damage or degeneration of the nerve cells that control the esophageal muscles. Some possible factors that may contribute to this damage include viral infections, autoimmune disorders, genetic factors, and chronic inflammation. Esophageal achalasia is a chronic and progressive condition that can worsen over time if left untreated. It can also increase the risk of complications such as esophageal cancer, aspiration pneumonia, and malnutrition. Therefore, it is important to seek medical attention if you experience any signs or symptoms of esophageal achalasia, and to follow the treatment plan recommended by your doctor. Signs and symptoms. The main symptom of esophageal achalasia is dysphagia, which means difficulty swallowing. Dysphagia can affect both solid and liquid foods, and it can vary in severity from mild to severe. Some people may feel like food is stuck in their throat or chest, while others may have trouble initiating swallowing or moving food down the esophagus. Dysphagia can also cause coughing, choking, or gagging during or after eating. Other common symptoms of esophageal achalasia include regurgitation, which means the return of food or liquids from the esophagus to the mouth or nose. Regurgitation can occur soon after eating or hours later, and it can be accompanied by a sour or bitter taste, bad breath, or dental problems. Chest pain, which can be sharp, dull, or burning, and can radiate to the back, neck, or arms. Chest pain can occur during or after eating, or at night when lying down. Chest pain can also mimic the pain of a heart attack, so it is important to rule out any cardiac causes before diagnosing esophageal achalasia. Heartburn, which is a burning sensation in the chest or throat caused by acid reflux. Acid reflux occurs when the stomach acid flows back into the esophagus, irritating the lining. Heartburn can be triggered by certain foods, drinks, medications, or lifestyle factors, and it can be worsened by esophageal achalasia. Weight loss, which can result from reduced food intake, poor digestion, or malabsorption. Weight loss can also affect the overall health and quality of life of people with esophageal achalasia. Diagnosis. To diagnose esophageal achalasia, your doctor will ask you about your medical history, symptoms, and family history. Your doctor will also perform a physical examination and order some tests to evaluate your esophagus and stomach. Some of the tests that may be used to diagnose esophageal achalasia include barium swallow, which is an X-ray test that uses a contrast agent called barium to show the shape and function of the esophagus and stomach. You will be asked to swallow a liquid or solid food mixed with barium, and then your doctor will take X-ray images of your chest and abdomen. A barium swallow can reveal the characteristic features of esophageal achalasia, such as a dilated esophagus, a narrow lower esophageal sphincter, and a bird's beak appearance of the esophagus. Esophageal manometry, which is a test that measures the pressure and coordination of the esophageal muscles and the lower esophageal sphincter. You will be asked to swallow a thin, flexible tube with sensors attached to it, and then your doctor will record the pressure and movement of your esophagus as you swallow water or air. Esophageal manometry can confirm the diagnosis of esophageal achalasia by showing a lack of peristalsis, which is the normal wave-like contraction of the esophagus, and a failure of the lower esophageal sphincter to relax. Endoscopy, which is a test that uses a thin, flexible tube with a light and a camera at the end, called an endoscope, to examine the inside of the esophagus and stomach. You will be given a sedative and a local anesthetic to numb your throat, and then your doctor will insert the endoscope through your mouth and down your esophagus. Endoscopy can rule out other causes of dysphagia such as tumors, strictures, or inflammation, and it can also detect any complications of esophageal achalasia such as ulcers, bleeding, or infection. Treatment: the treatment of esophageal achalasia aims to relieve the symptoms and improve the function of the esophagus and the lower esophageal sphincter. The treatment options depend on the severity of the condition, the age and health of the patient, and the preference of the patient and the doctor. Some of the treatment options for esophageal achalasia include medications, which can help relax the lower esophageal sphincter and reduce the pressure and spasm of the esophageal muscles. Some of the medications that may be used for esophageal achalasia include nitrates, calcium channel blockers, anticholinergics, and botulinum toxin injections. Medications are usually the first-line treatment for mild cases of esophageal achalasia or for patients who are not suitable for surgery or other procedures. However, medications may have side effects such as headache, dizziness, low blood pressure, or dry mouth, and they may lose their effectiveness over time. Pneumatic dilation, which is a procedure that uses a balloon to stretch and widen the lower esophageal sphincter. You will be given a sedative and a local anesthetic to numb your throat, and then your doctor will insert an endoscope and a deflated balloon through your mouth and down your esophagus. Your doctor will then inflate the balloon at the level of the lower esophageal sphincter, creating a controlled tear in the muscle. This will allow the lower esophageal sphincter to open more easily and let food and liquids pass into the stomach. Pneumatic dilation is usually performed as an outpatient procedure, and it may need to be repeated once or more to achieve the desired results. Pneumatic dilation can provide long-term relief for up to 80% of patients with esophageal achalasia, but it may also cause complications such as bleeding, perforation, or infection. Surgery, which is an operation that cuts the muscle fibers of the lower esophageal sphincter, called a myotomy. This will reduce the pressure and resistance of the lower esophageal sphincter and allow food and liquids to pass into the stomach. Surgery can be performed as an open or laparoscopic procedure, depending on the expertise of the surgeon and the condition of the patient. Surgery can provide long-term relief for up to 90% of patients with esophageal achalasia, but it may also cause complications such as bleeding, infection, or injury to nearby organs. Surgery may also increase the risk of acid reflux, so it may be combined with a fundoplication, which is a procedure that wraps the upper part of the stomach around the lower end of the esophagus, creating a valve-like mechanism to prevent acid from flowing back into the esophagus. Peroral endoscopic myotomy, which is a newer and less invasive procedure that combines the benefits of endoscopy and surgery. You will be given a sedative and a local anesthetic to numb your throat, and then your doctor will insert an endoscope and a special knife through your mouth and down your esophagus. Your doctor will then create a tunnel inside the wall of the esophagus and cut the muscle fibers of the lower esophageal sphincter from within. This will reduce the pressure and resistance of the lower esophageal sphincter and allow food and liquids to pass into the stomach. Peroral endoscopic myotomy is usually performed as an outpatient procedure, and it may have fewer complications and faster recovery than surgery. However, peroral endoscopic myotomy is still a relatively new technique, and it may not be widely available or covered by insurance. Oral endoscopic myotomy may also increase the risk of acid reflux, so it may require long-term medication or additional procedures to prevent it. Lifestyle and home remedies. In addition to the medical treatments, there are some lifestyle and home remedies that can help manage the symptoms and complications of esophageal achalasia. Some of these include eating smaller and more frequent meals and avoiding foods that are hard, dry, or spicy. Drinking plenty of fluids, especially water, to help lubricate and soften the food and ease its passage through the esophagus. Chewing the food well and swallowing slowly and carefully, and avoiding talking or laughing while eating. Elevating the head of the bed or sleeping on an incline to prevent regurgitation and acid reflux at night. Seeking professional help for weight loss, nutrition, or psychological support, if needed. Esophageal achalasia is a rare and chronic disorder of the esophagus that causes difficulty swallowing, regurgitation, chest pain, heartburn, and weight loss. It is caused by a failure of the lower esophageal sphincter to relax and open properly, which prevents food and liquids from passing into the stomach. The exact cause of esophageal achalasia is unknown, but it may be related to nerve damage, viral infections, autoimmune disorders, genetic factors, or chronic inflammation. Esophageal achalasia can be diagnosed by a combination of medical history, physical examination, and tests such as barium swallow, esophageal manometry, and endoscopy. The treatment of esophageal achalasia aims to relieve the symptoms and improve the function of the esophagus and the lower esophageal sphincter. The treatment options include medications, pneumatic dilation, surgery, and peroral endoscopic myotomy. Lifestyle and home remedies can also help manage the symptoms and complications of esophageal achalasia. Esophageal achalasia is a serious and progressive condition that can worsen over time if left untreated. It can also increase the risk of complications such as esophageal cancer, aspiration pneumonia, and malnutrition. Therefore, it is important to seek medical attention if you experience any signs or symptoms of esophageal achalasia, and to follow the treatment plan recommended by your doctor. Thank you for watching.